My name is Andrea Pokorna. I'm from the Czech Republic. I'm working there at the Masaryk University as a full professor of nursing. And here at EWMA, I'm serving as a scientific recorder, which means that I am responsible for the scientific content of the conference. A EWMA annual conference, which is held now in London, is a conference which is focused on patients with wounds and the caregivers and healthcare professionals. So it means for people or two people who are caring for patients with wounds of different types, like pressure ulcers, diabetic foot ulcers, or venous leg ulcers. We are quite well supported by the industry, which is very important because they are bringing new technologies. But we are also collaborating with lots of national organizations, which we call cooperating organizations. And we are also promoting some projects for the research and academic communication and collaboration. EWMA is here for the healthcare professionals who are working with patients with wounds. There is a lot of features which influence the quality of care. So we are very happy if we are aware of new technologies, of new approaches, because then we can deliver it to the clinical practice. So if we collaborate with Force Repair, we have a better chance to implement it in clinical practice, influence the quality and safety of care.
I'm Damien Dupin, head of the biomaterial unit in City Nanomedicine, a research center based in Spain. And I'm the coordinator of Force Repair project. The Force Repair project aims at developing a new treatment, a new wound dressing to treat chronic wounds. It's going to be quite a complex one. We are going to try to fight infection, to control inflammation, and to promote the healing process of the chronic wound to improve the quality of life of patients. The main issue with chronic wounds, it's a very, very complex process. It involves infections, so a lot of bacteria, so your body wants to fight them. Then there is the inflammation, and after all of that is impeding the wound actually to close and to heal. So what we are going to try to do, it's a step-by-step process with the same product. First fight infection, then control inflammation, and after have biological cube inside our dressing to promote all the parameters that needs to be done to obtain a full skin regeneration. Main innovation of Force Repair, it's all-in-one product. We are going to try to fight to sort out everything with only one product. And in addition, to do that, what we need to have, it's a technological advancement in terms of manufacturing. We are going to use a 3D printer with a special software to be able to produce that wound dressing personalized to the patient and adapted its healing process. We are at the EWMA conference. It's a very important event. First of all, EWMA is partner of the project. But more importantly, there is specialists in terms of products that are sold for chronic wounds. But more importantly, there is patients and the nurses that are going to be using our product. So it's very important to have their feedback, that they understand that although the product could be a bit complex, it's very easy to use. And it can actually help them having a bit less job and taking care of more patients.